Teenage Obesity, starring Lauren, Megan, and Charlotte. Teen obesity is a major issue in society today. It affects our friends, family, and our peers. What is obesity? A child is not considered obese until the weight is at least 10% higher than what is recommended for their height and body type. Studies show that a child who is obese between the ages of 10 and 13 has an 80% chance of becoming an obese adult. This photo shows the vicious cycle of childhood obesity.
Obesity in childhood and adolescence. Between 16 and 33% of children and adolescents are obese. Most recognizable medical conditions caused by obesity are difficult to treat. It is responsible for over 300,000 deaths. The annual cost to society for obesity is estimated at nearly $100 billion. Obesity in childhood and adolescence can be related to poor eating habits, overeating or binging, lack of exercise, family history of obesity, medical illness such as neurological problems, medications such as steroids or some psychiatric medications, stressful life events or changes such as separations, divorce, moves, deaths, or abuse, family and peer problems, low self-esteem, or depression and other emotional problems.
Complications of child and teen obesity. Some physical consequences include increased risks of heart disease, high blood pressure, diabetes, trouble breathing, and trouble sleeping. Teens with weight problems tend to have low self-esteem. They tend to be seen as less popular with their peers, depression, anxiety, and obsessive-compulsive disorder.
How can obesity be managed and treated? One would need to get a thorough medical evaluation to consider the possibility of a physical cause. The only way for one to lose weight is to reduce the number of calories being eaten and to increase level of physical activity. Finally, the only way to keep weight off is when there is self-motivation.
Ways to manage obesity in children. You should start a weight management program, change your eating habits, plan meals and make better food selections, control your portions and consume less calories, increase physical activity, and there should be parental supervision such as know what your children eat at school, eat meals as a family instead of watching TV or play on the computer, do not use food as a reward, and limit snacking.